The latest data from DHEC shows that South Carolina is now home to the country's third highest COVID-19 spread rate among children, behind only Arizona and Tennessee. The report from the American Academy of Pediatrics says more than 15,000 children were infected with coronavirus since the pandemic started. This new report comes as back to school is happening for kids across the upstate. Fox Carolina's Matt Koufax reviewed that data, talked with medical professionals, and joins us live tonight outside Prisma Health with more.
Yeah, Tori, Shell. So in addition to being third among states in terms of spread rate among children, South Carolina also eighth among all 50 states in terms of the total number of infections. We did speak with one Prisma Health doctor in those infections for 20 and under children, I should say. We spoke with a doctor and took a look at the numbers county by county to make sense of it all.
Dr. Joshua Brownlee says that today's AAP report shows one thing beyond a shadow of a doubt. The myth that children can't contract COVID-19 is just that.
Children are susceptible to this disease as anyone else is.
The numbers say it all. Those 20 and younger with COVID-19 in the state make up 15% of the total cases. The Palmetto State is also 8th out of 50 states in cases among children, despite only having the 23rd largest population. But Brownlee says there are some question marks.
There's not a uniform way in which this data is reported out of the individual states.
And he's right. Several states identify children as ages 0 to 14. Others 0 to 24. South Carolina is in the middle.
Are we easier to get into? Are we testing more kids? Do the providers here have a lower threshold for testing children than other states?
He says not having a national standard of testing doesn't help either.
If there was more uniformity between states in how the data was reported into these national databases, we would more easily be able to compare apples to apples as opposed to sort of apples to oranges, which we're trying to do now.
According to DHEC, the most cases, about 20% of the total in both Spartanburg and Greenville counties, occur in those 21 to 30.
Young adults have been a bigger portion of that because of some of their inherent behaviors and socialization, as well as they've been out in the workforce a little bit more.
But Brownlee also says back to school provides a unique challenge for the youngest of us.
There's going to be an increase in community transmission when kids go back to school. What we want to do is keep that to a very low level.
Brownlee says school districts have been preparing, but now they need to follow through on safety.
We're going to have to work at it. It's not going to be easy.
Now, we should mention that the doctor also says that the symptoms that can present themselves in children are a lot lesser in terms of COVID-19 than they are in adults, but that they can still get it pretty easily. So the only way to curb the spread, manage the spread, is to enforce those practices like distancing, wearing a mask, washing hands, sanitation, etc., to an extreme degree, especially in these schools. He says that is the only way that they will stay open throughout the rest of the school year and potentially even get better. In Greenville tonight, Matt Koufax, Fox Carolina, the 10 o'clock news.